skeletal system provides infrastructure for the human body. Think of the skeletal system as the framing for a building. Without the 2x4s underneath, drywall and paint are useless. Without our bones, there would be no structure for our other systems and tissues. Our bones also provide critical protection for many of our organs, such as the heart, lungs, kidneys, spleen, etc. Our joints make it possible for us to move in conjunction with the muscular system, and the bones themselves create blood cells in the bone marrow and store minerals. Working our way from the top to the bottom, we first encounter the skull. The skull is the bony structure of the head. Its main purpose is to enclose and protect the brain. On the anterior side is the face. There are several bones that make up the face. The function of the face is obvious. The eyes are protected by the facial bones, as are the superior portions of our respiratory and digestive systems, which we will discuss later. Beneath the head is our spinal or vertebral column. Our spine consists of 33 separate vertebrae, all designed to keep us upright, provide for motion, and protect our central nervous system and spinal cord. The spine is divided into 5 parts. The first is the cervical spine, consisting of 7 vertebrae. This is the portion of the spine laymen would describe as the neck. Proceeding inferior are the 12 vertebrae of the thoracic spine. These vertebrae form the upper back and also are connected to the posterior rib cage. Inferior to the thoracic spine are the 5 vertebrae of the lumbar spine, which form the small of the back. Inferior to the lumbar spine is the sacral spine, which is actually 5 separate vertebrae fused together to form a structure known as the sacrum. Lastly, we come to the coccygeal spine, which contains 4 vertebrae fused together to form the coccyx. To tell the difference between the various vertebrae, they are named based on their relative position within these spinal regions. Cervical vertebrae are labeled with a capital C, followed by the number 1 through 7, with C1 being superior and C7 being inferior. The same is done for the thoracic vertebrae, using the letter T and the numbers 1 through 12. The lumbar vertebrae use an L and the numbers 1 through 5, and the sacral vertebrae use an S and the numbers 1 through 5 as well. The spine is so very important to the health of the body given its protection of our spinal cord. Significant injuries to the spine can result in chronic pain, paralysis, or even death. As a result, spinal precautions for trauma patients will be covered in tremendous depth later within this course. Anterior to the vertebral column, inferior to the skull and face, sits the thorax. In lay terms, the thorax is a person's chest. The ribs and other bones of the thorax serve primarily to protect our vital organs and major blood vessels. In conjunction with the diaphragm and intercostal muscles, the thorax also produces both negative and positive thoracic pressure that results in ventilation, breathing. Inferior to the thorax sits the pelvis. The pelvis consists of 3 separate bones that are fused together, and it serves as the foundation, the basement floor if you will, for the organs located above it, such as the intestines, bladder, and female reproductive organs. It also provides varying levels of protection for those organs as well. Continuing down, we encounter the lower extremities, otherwise known as the legs and feet. The large bone connected to the pelvis is the femur. Inferior to the femur are the tibia and fibula, which form the lower leg. To differentiate the 2 bones, the tibia is commonly called the shin bone. The patella is the bone that covers the knee joint between the femur and the tibia. On the bottom of the lower extremities are the tarsals, metatarsals, calcaneus, and phalanges of the ankle, heel, feet, and toes. Lastly, we need to move back up the body to discuss our upper extremities. Connected to the thorax are our shoulders, arms, and hands. The shoulder consists predominantly of the clavicle, or collarbone, the scapula, the flat bone on the posterior side, and the proximal humerus. The upper arm is therefore called the humerus. Distal is the elbow joint that joins the humerus with the distal arm bones, the radius and ulna. The radius is the lateral bone of the forearm. It is always aligned with the thumb. Distal from the radius and ulna are the carpals, metacarpals, and phalanges of the wrist, hands, and fingers. Remember that bones are rigid and do not bend. So that we can move, our skeletal system also contains joints where these rigid bones meet. Some joints work like hinges, such as the knee and elbow. The joints between vertebrae allow for rotational movement so we can twist and turn our bodies, in addition to allowing us a certain amount of flexibility to bend over and backward. Ball and socket joints, such as the hip and shoulders, provide for tremendous articulation and range of motion. Ligaments, cartilage, bones, muscles, and tendons all work in concert to provide for movement. Injuries to the skeletal system can have dire consequences given its role in protecting organs, providing structure, and allowing for movement and range of motion. Addressing issues pertinent to the